Okay, I'm here in a live telehealth session. It's behind me on my computer, and I want to show you how to do a screw home mechanism for the hip joint. This is for femoral head centering. I use this when someone has taken a cross-country flight or a really long drive, or maybe they're not yet at the point where they have enough motor function to be able to fire the gluteal sling and the deep hip stabilizers without over recruiting all of the hip flexors in the interior, the front musculature of the hip. So this is what I call a screw home mechanism into the hip to center the femoral head so that you get less impingement, less pain, and better function. Now, in a pinch, you can do this in many different positions. So you don't have to have fancy equipment. It doesn't have to be expensive. You can use a door jamb. But today I'm going to show you a simple method, which is if you don't have a piece of furniture you can push into, like a treadmill, and then you have another piece of furniture on the other side that you can push into that won't move. If you don't have that, maybe you can use a yoga belt. You can put that yoga belt around you. Don't get the buckle pressing into you, that's gonna hurt. And you're gonna make sure the other knee is bent, okay? So I've got a bent knee, or the knee you're working on is bent. Put it on the ball of your foot, and then bring yourself out. See how my knee is still bent? I want you to have this below the iliac crest, which is right into the bulk of where the glute med is, so you can feel it contracting into the belt. If that bothers you too much, you can go a little higher. If you have more sacroiliac joint problems, I want you to have it lower. And then I just want you to press into that strap. But it's not just about pressing into the strap, it's about also pressing the other hip back at the same time. So I'm going to press into that hip backwards and press your foot forward into the strap, and I should feel all these muscles fire really strongly. But I don't get a whole lot of over gripping in the front. That's the motor trick. That's your motor snapshot that you want. And that really is kind of hitting at the heart of what physical therapy is quite often. So press the ball of the foot into the strap, press your back hip backwards into the strap. You're getting co-contraction through the leg, and it kind of pulls. Imagine the long bone, this femur, the long bone here spiraling up and centering that femoral head. That's our goal. Okay, it should help you have less pinching through the hip and less pain. And of course, if you have any issues with it, you can get in touch with me, and we can refine that or address this specific issue. All right, that is your screw home mechanism for the hip.